In this video, we shall learn about oxygen therapy in neonates. Oxygen therapy may be required in babies with respiratory distress, central cyanosis, and shock. Always remember that oxygen should be considered as a potentially toxic drug and should not be given for any minute longer than needed for the baby. Oxygen therapy can be administered by a nasal prongs or by a hood. First, attach the flow meter to the oxygen cylinder or the central oxygen supply. Fill the humidifier with distilled water so that the oxygen delivered is humidified and not dry. Now, attach the oxygen tubing. We shall first learn about the administration of oxygen by prongs. Set the flow rate at 0.5 to 1 liter per minute and not more than 2 liter per minute. Observe if bubbles are coming out. Remember, the flow rate should be adjusted so as to maintain the saturation between 91 to 95%. Both hypoxemia and hyperoxemia can be harmful for the baby. Use appropriate size nasal prongs based on the weight of the baby so that it snugly fits into the nasal cavity. Position the baby's head in midline and keep a shoulder roll to keep the neck slightly extended. Secure the nasal prongs by a skin-friendly adhesive tape to avoid accidental displacement. Use a pulse oximeter to note the saturation and adjust the flow rate so as to maintain the saturation between 91 to 95%. Let us now understand the important points which are to be considered while administering oxygen by hood. Set the flow rate at 2 to 3 liters per kg per minute. Observe if bubbles are coming out. The flow rate should not be less than 2 liters per minute. Position the baby's head in the midline and keep a shoulder roll to keep the neck slightly extended. Keep the clean hood over the baby's head. The opening seen in the front portion of the hood should be at the level of the baby's neck. Now secure the oxygen tubing inside the hood using adhesive tape. Always use a pulse oximeter to note the oxygen saturation, which should be maintained between 91 to 95%.